Joining us now is cardiologist Dr. Jane Morgan. Doctor, thanks for being with us. Walk us through the results of this study. Obviously, this is encouraging news, helping women in particular at a time in their life, menopause, where we know there's all sorts of gaps in coverage and women seem to lack the amount of information to make it through.
Thanks, Steve and Natasha. And you're right on the mark, Steve. Menopause has just been overlooked. It has just been a blind spot in our entire health system. And yet menopause is a time of increased risk of heart disease and heart attacks of women. And hypertension is one of the key factors that drives that. So when we look at how can we control hypertension in women who are midlife, it turns out that a study at Hello Heart shows that digital interventions have a greater response in women. In fact, when they compared age-matched women to men at midlife, women had a greater blood pressure reduction. And then when we compared menopausal women to premenopausal women, the blood pressure was reduced equally, even though the menopausal women started at a higher blood pressure. So when we look at artificial intelligence, digital footprints, this is where the future is going, and I think women's health is right on the precipice of driving that.
It's really interesting. So in particular, do you have any examples? Is it like, you know, the wearables around your wrist that's tracking your heart health? Is that what we're talking about here?
And when we look at Hello Heart in particular, it's a cardiovascular system. It's a blood pressure cuff that then is Bluetooth enabled to your phone. And then a gaming system really is involved where people can interact with it, get complete readouts over time. The artificial intelligence learns more about you. It can indicate, say, hey, Steve and Natasha, when you get out of your morning meetings, your blood pressure seems to be high on Wednesday morning. And then begins to track what's happening in those meetings and gives you that intelligence. You also have the ability to send your blood pressures to your physicians, because as physicians, what are we beginning to recognize? That one snapshot of blood pressure in the office really doesn't represent what's happening to you all day when you're out, what we call in your native environment, in your real world. So we need to depend and begin to utilize these remote monitors to give us real-time information on our patients, where they live and what they're doing, and not just that time when they're in the office. That's an artificial measure of your blood pressure.
Yeah, that makes sense for sure. All right, well, today, new guidelines for those suffering from high blood pressure recommend skipping alcohol and starting treatment even earlier than previously recommended. Walk us through what we've learned on this subject.
Super important. We know, and all of these organizations, the American Heart Association, the American College of Cardiology, American Medical Association, even the FDA, are recognizing that even small decrements, meaning decreases in blood pressure, have significant impact on your risk of heart disease. So if you can lower your blood pressure just by 10 millimeters systolic, that top number, you can lower your risk of a lifetime cardiovascular disease by 20%. So in recognition of that, the American Heart Association has put in more strident guidelines. They want physicians to begin to act now when your blood pressure is between 130 to 139. We want to bring it down to 120. And we're not going to wait for your blood pressure to get up much higher. There's also a recognition that pregnancy complications like high blood pressure during pregnancy also increase your risk of heart disease and long-term hypertension. And again, these digital interventions are incredibly important to help control blood pressure in pregnancy and make certain that that pregnant woman can keep that blood pressure down and decrease her risk of long-term heart disease. And then there's also the recognition of dementia and high blood pressure. Greater risk of dementia, the higher your blood pressure is and the more sustained it has gone on being untreated. And then those recommendations on alcohol. I hate to tell that to your audience, but the recommendation is really no alcohol. If you do drink alcohol, it's less than 1 drink a day for women, less than 2 for men. That's because alcohol just has so many toxicities that it cannot be recommended.
Yeah, absolutely. Doctor, we got to leave the conversation there. Thank you so much for joining us.
Thanks, Natasha.